Meeting to order, please. First item on the agenda is approval of the agenda. The chair will entertain a motion.
So moved. Support.
Thank you, Commissioner Williams and Commissioner Bear. Any questions with respect to the agenda? All those in favor will please say aye. Aye. Any opposed? Thank you. We're now up to public comment. Public comment for 3 minutes. Is there public comment? Is there public comment? Last call for public comment. Public comment is now closed. We move on to committee items. First item is minutes from the meeting of July 4th. Chair will entertain a motion to approve.
So moved. Support.
Thank you, Commissioner Bear and Commissioner Williams. Any questions with respect to the minutes from last month?
No.
All those in favor will please say aye. Aye. Any opposed? Thank you. We're now up to the Lifeways quarterly report. I see Cassie here. Welcome, Cassie.
Thank you, Mr. Chair. Can everyone hear me okay? Okay. So my name is Cassie Watson. I'm the Executive Director of Clinical Services at Lifeways. I'm here to present the Lifeways August report on behalf of Mary Beth, who couldn't be here today. The first item on the report is our Certified Community Behavioral Health Clinic. And so we average about 5,520 encounters per month. Our goal internally is actually 5,100 encounters per month. So we are seeing not only that trend upwards, but also we are hitting the internal goal markers that our finance department has established for us. We are also working to establish what's called an assertive community treatment team. That team actually serves individuals who are highly complex, high needs, and high cost individuals. So these are individuals who may routinely go to the hospitals and have a high cost in the public system. And so our goal is actually to more aggressively treat those individuals through an interdisciplinary team that allows us to address their needs more proactively and also reduce the costs at the outset. The next item is the fiscal year 26 budget. We are still waiting on the state to finalize the budget for MDHHS and then receive the information on our budgets. But internally, what we've done, because we have to have our budget prepared and approved by September, is that we've asked all of our departments internally to reduce their costs by at least 3%, with the goal being more. But that 3% departmental reduction, it will get us closer to where we think the state budget will be. But again, we're still waiting on finalization of the state budget. One of the activities that we are partaking in currently is the residential services, which is where we have found across our region, across the state, our residential service rates are actually higher than the average. And so internally, what we've done is taken a look at what's contributing to that, and we're working with our residential providers who house these individuals. They provide community living supports. They are providing that one-to-one or one-to-two care to individuals, most frequently with intellectual and developmental disabilities, but saying, you know, why are the rates so high? Is there a way for us to actually reduce the rates? And let's look at that as a collaborative team. And then we're doing a tabletop exercise to look at that before we say this is how we're going to approach it. This is how we're going to reduce costs. So really trying to bring the providers to the table to have a dynamic discussion so that we're not just dictating how we do that. The next item on the report is our public relations activities. So I just want to thank anyone who did attend our legislative event on the 25th of July. Thank you so much for being there. We did specifically address what's known as the PIHP procurement, which is later in the report. But we specifically addressed our concerns related to that on our system, and I really appreciate that anyone that was able to attend or any of the advocacy efforts that you might be partaking in. We had a great turnout. We were really excited to see the community come out just to learn so that we could provide education to them. We're really excited. The next item on the report is the Healthcare Angels. We're very, very honored to name LaShonda Walker as one of the individuals who received a Healthcare Angel Award in Jackson County. As you know, these are individuals who exemplify excellence in healthcare and positively impact patient lives. So our recipient rights specialist, LaShonda Walker, will be honored on September 3rd. Really, really excited to see her name there. The PIHP procurement is the next item on the report. This is the prepaid inpatient health plan procurement request for proposals by the state of Michigan. This was, as of the time of this report, not released. So we didn't have a release date as of the time this report was put together. We have since seen that the RFP was released on August 4th. So that was last Monday. So we have ongoing meetings on to determine what the actual RFP contains, because as of this report being put together, we didn't really know what the RFP was going to include. So we're looking at the RFP right now. Mary Beth is participating in meetings with the state, with our region, and then also with the Association for Community Mental Health Agencies. We really appreciate your support in opposing the procurement, and also if you could do any more further advocacy, we will share that information if you want to reach out to legislators or submit those action alerts, which the information we can share with you, then we would appreciate that as well. The next item on the report is the direct pay for CCBHCs. This is really informational. The state of Michigan has moved that CCBHCs will receive their payments directly rather than through the region, the PIHP currently. So we are working with our internal teams to prepare for that. It is going to have an impact on staffing and also processes, and we don't have a lot of clarity, and it goes into effect on October 1. So we are actively working as quickly as we can to be ready for that change. And the final item on the report is the One Big Beautiful Bill Act, which current state, we don't know what the impact on Michigan is. There is some information in this report related to what we think will happen to Michigan. What is important to know is that Lifeways is paid on a per eligible per month basis, which means if the number of eligible individuals for Medicaid is reduced, then the amount of dollars for service delivery for the individuals that we serve is also reduced. That's why we're really focusing on cost containment, but also on revenue generating activities. For example, the CCBHC encounters our revenue generation for local activities, which allows us to continue to provide services at the same level, or hopefully the same level as we do now. So we're focusing our efforts on how do we generate revenue, how do we cut costs, how do we make sure everything that we're doing is medically necessary, and that we're prepared for any reductions in funding that could occur with the act. But again, we don't know how the state responds. The state could say we're going to match what the funding level is currently, but they'd have to use general fund dollars for that. They could change the Healthy Michigan, the optional enrollment. So there's a lot of factors that are just unknown that we're just trying to keep our eyes on to prepare for. And with that, are there any questions?
Questions for Lifeways? Commissioner Kennedy.
I don't see it directly in this report. I see you touching on two things that could have some adverse impact on your organization, but I did catch the news segment with Mrs. Leonard, and one of the concerns was of privatization, and so in other words, of having Lifeways, it could be other providers. How concerned would you guys be that that would take away the one centralized location here in Jackson and then Hillsdale, and that now it would be broken up into a bunch of small different practitioners that people would have to find?
Sure. So your question is specifically the concern that Lifeways has identified of being kind of relegated to a provider.
What's the potential of that happening?
Sure.
I guess is my question.
The answer that I can give you right now is it's unknown based on the review that we've had of the released information, whether the CMHSPs, which is what Lifeways is, will be a provider or retain their status. What the RFP does include from the initial review is that the new PIHP region, which will have 33 counties in it, will have to contract with the CMHSP, but it's unclear. It was very clear also that they could contract directly for services with providers. So I think to your point, the concern is if we have the state or the PIHP now contracting equally with providers and the CMHSP, where do people go for care? How do you standardize it? How do you make sure that it's a very seamless process for people who are under-resourced and also very, very ill? That remains a concern based on the initial reviews of that document.
So just my only follow-up is there's a lot of like ifs. When are you going to get I guess, clarity on exactly what is gonna happen? Have they given you a solid date as to when they'll give you specifics?
Sure. So there's a bidders conference today, which is why Mary Beth can't be here today. So we will have some additional, at least information, preliminary information from that today, also from meetings this week. And then the timeline is that all submissions have to be submitted by, I want to say it's October. Or late September, which means it's a very short turnaround. So we should have some very clear information relatively quickly within the next week or so. But what was in the RFP that would be concerning to all of you is that there are 33 counties in this new PIHP region. There are only 15 seats on the board for the PIHP region. So that is not representative of all counties. And at least a third of those seats have to be held by a direct consumer of care. And at least one of those individuals has to also be a family member of a youth receiving services. So those are not individuals that represent Jackson or Hillsdale County, or could be individuals that don't represent Jackson or Hillsdale County. And so that is one of the primary concerns that we have too, is that voice of the counties and how the counties need funds used is potentially going to be muted by all the other voices that are at the table, because it's a max of 15 board members.
Thanks.
Did that answer your questions? Okay.
So am I right then, Cassie, to say, I mean, that right now, the PAHP that we're part of, which is Mid-State Health Network, is a smaller area with representation by all of the mental health authorities that are within it.
Correct.
Okay? So we all have representation. As I understand it, under the proposal, our PIHP is prohibited from bidding. Is that right? But we're going to bid anyway, because we think that our structure is appropriate. It's provided and permitted under the mental health code. Whereas the new PIHP that the state would have us set up is not. So one of the responses that we're going to do, Corey, is that Mission, Mid-State Health Network, of which Lifeways is a part, would bid to have its projects go forward as it normally has done. Start to tell me when I'm wrong, Cassie, okay?
Sure. So I'll just add that we did learn just recently that governmental entities can apply. So Mission is intending to apply. They now are allowable. They have to become NCQA accredited. They are not currently. That's not typical of any PIHPs or CMHs to be NCQA accredited, but it's still in its form today. The RFP does violate the mental health code, and it only references the mental health code about 3 times in the document. So
we have to figure out what our response is going to be in order to carry on business as we have and as we prefer. So that is one level of uncertainty. The other level of uncertainty to which Cassie alluded is federal changes, the One Big Beautiful Bill, where revenues applied for Medicaid recipients, which is the vast majority of Lifeway's revenues, has been reduced by this 13 some odd percent. So that's another uncertainty with which Lifeways and other mental health authorities are having to deal. Did I say that properly?
yes, that's
Okay,
correct.
all right. So, and then on top of that, of course, Lifeways is working still with our consultants to see what our next location in Hillsdale might look like.
Correct.
So that's another level of uncertainty that we're just trying to deal with. The object being to try and treat folks with mental illness in our areas as well as we can in a financially responsible way. The chair will entertain a motion to receive the report from Lifeways.
So moved. Support.
Thank you, Commissioner Bear and Commissioner Williams. All in favor will please say aye. Aye. Any opposed? Thank you. Thank you, Cassie.
Thank you so much.
Now on to the Department on Aging monthly report. Madam Director.
Good afternoon, everybody.
Welcome.
Just a few updates for this month. We're currently working on our senior safety conference. and that's something that we're putting on with Wellwise Services. So we received a mini grant of $1,900 to go ahead and do a senior safety seminar. And so what we're looking at with this is to have American One through their fraud fighters division come in and do a presentation that'll be open to the public for that. Generally, our target group, of course, is those that are 60 and better. It'll be on September 24th. And usually each year when we try to do this, we try to combine a shred day on the same day. That was something that wasn't able to happen this year, but we were able to have Vital Shred come in on September 25th. And they'll be doing a shred day that'll be open as well for our older adults and caregivers in the community. They try to limit it to like a 5-box kind of drop off where they'll go ahead and take care of those documents for everyone. But again, we're pretty excited for this opportunity. And the older adults, when they come, will receive like a pocket magnifier. I know if you're like me, sometimes when you're trying to read something and the print is so small, you want to make sure what you're signing or reading before you respond to it. And sometimes you take a picture of it and zoom in. And we were actually able to use the grant to purchase some magnifiers that we'll hand out to them. So they'll walk away with something that'll be fun, as well as educational too, because again, you don't want to be signing things that you shouldn't be. The other thing that we're working on is we have Wellwise Services has Martha York, who's trained as a presenter, working with Impart Alliance, and she's been working with our home care workers and presenting on various topics. The nice part about this education component for our home care workers is that they're often not together as a group. They're always out in the community seeing individuals in their homes. So the most that they come to our office is every other week when we're working on timesheets, or maybe they're picking up a care plan, something like that. So it is a great opportunity for the staff to get together as a group, focus on a topic, delve into that. They do some small group exercises around the different topic that's being presented. So Martha's been really easy to work with. So we're excited that they have this grant that's going to continue, and that we can continue to with educational components for our staff as well. I just wanted to highlight, it's kind of reflective on the month of June, some different things that were provided as far as services that have been out there in the community for our Jackson County citizens. I think the biggest thing is looking at those numbers of meals that are being out there in either in the seniors' homes or at our nutrition sites across the county, over 30,000 meals. And when you think about our staff, where you have only 4 full-time and 2 part-time individuals that are putting those meals together, and definitely creating a nutritional meal for older adults and our caregivers. So we definitely are very thankful and have a great team. So kudos to them. As far as different numbers to look at is that we're doing outreach in the community for, we're doing 697 people received home delivered meals during the month of June. 207 people received an in-home service, which would be like personal care, going in and helping with a shower or a bath, whatever's needed for that person, assisting with housekeeping services, respite care for caregivers, and over 1,000 hours of service put out there to help support older adults and caregivers in the community. When you talk about in-home visits, when I throw out that, it shows 96 individuals were assessed. And these are people that might be new to services and they want somebody to come out and talk to them about programs that are available. And again, when we go out there in the community, it's not just education about what we do. If somebody would be would receive more support from another entity like Wellwise Services, Tome Pace, maybe they're lower income and they qualify for a chore provider from MDHS. It's mainly that whole educational piece that's happening to make sure that people are getting the best services available to them. And I like the number of 82 individuals that are new to our senior center. So I think that we've reached over 1,500 people in the year so far that have received support from the senior center, whether they've come in for an activity, received an educational program, came to a dance, kind of that fun part where we try to get out there and provide that opportunity to individuals. And as you scroll down, I put a couple community member notes, and the one where we talk about people coming into the senior center, there's the note on the one side that talks about our enrichment specialist, which is Lori Mead. I think one of the things that they talk about in that note is that how she is such a good listener, and she's see, that's where I need my magnifier right now. And she's and she's always doing things in a welcoming manner. Again, I think just being open to ideas and starting new programs. We're starting a hand and foot card game based on comments received from our advisory council, as well as talking with seniors if they would like to try something like this. So we're going to be starting that activity this month and see how that takes off. So I think just being good listeners, talking to the people, and I think that's something our staff is very good about. So, and again, there was a comment on there as well, just about Meals on Wheels. Somebody that sent in something where they're gaining weight and strength, and that really is something when you think about the Meals on Wheels is trying to support older adults where they're at, keeping them at home if that's where they choose to be. So, that's kind of the stuff I wanted to highlight for this month.
Okay, questions for the Department on Aging? Seeing none, Chair will entertain a motion to receive the report.
So moved. Support.
Thank you, Commissioner Williams and Commissioner Bear. All those in favor will please say aye. Aye. Any opposed? Thank you.
All right, thank
Thanks,
you.
Danielle. And now the medical care facility, Madam Director, I think is here. Good to see you, Destiny.
Hello. Thank you for having me today. So to start off our report, I just wanted to go through a few quality statistics here that I think would be helpful for you to have. I did pass out a packet to everyone ahead of time. Hopefully you have one at your seat. So first I want to start by just letting you know that Jackson County Medical Care continues to be a 5-star facility. On the third page of your packet, you can see the ratings across our market area, which we consider a 25-mile radius from the facility, and where we rank compared to the other facilities in our market area. We have 5 stars overall. We have 4 stars in survey, 4 stars in quality, and 5 stars in staffing. We are one of 2 homes with 5 stars overall in our market area, one of 2 homes with 5 stars in staffing in our market area. And then we also have the lowest nursing turnover rate in our market area of 24.3%. And if you recall from previous reports, that number has come down tremendously over this last year. So I just wanted to share that with you because that's really exciting to see. And then we now have the lowest RN turnover rate in our market area at 7.7%, and we are the 9th lowest RN turnover rate in the state. So I thought that those were some really good numbers to be able to share with you. In addition to that, we have now gone our longest length in time between the last time a nurse had to be mandated to work an extra shift. We made it 7 months with no mandations. So I thought that that was something worth sharing and celebrating. And then we also have been added to the hospital's preferred provider network. So the hospital has certain metrics for all of the homes in this area that they ask for us to meet to be able to be part of the preferred provider network. The first time around, we were about less than a percentage shy on one of the metrics that we needed. So this time around, we made that cut, and we're very excited about that. And then I'm going to jump into the finance reports here for you. This does include April through June. If you recall, April, we were a little bit later on getting those financials. We made some transition with our finance director role, so we currently have a partnership with Calhoun County where we are contracted with their finance guru over there, and she's been handling our financials for us since April. And there was a little bit of a hiccup in that transition, just how work papers were set up and making sure everything translated. But we're in good working order now. So for April's financials, revenue, we were behind budget by $111,581. Expenses were over budget by $5,062, with a net position change of negative $116,643. Our census was right on budget for the month of April. I will note that we did do a budget amendment in April that impacted April, so that is part of where we're seeing a little bit more alignment on the expenses and census side there. For May, our revenue was $125,529 behind budget. Expenses were only $1,457 behind budget, with a total net position change of negative $126,986 behind budget. And census was almost right on with being behind budget by 0.28. So I'm not sure where that quarter of a person was, but they were not there for the month of May. For June, our revenue was $44,599 behind budget. Now here you'll see the expenses are considerably over budget here of $148,407. One of the things that I really want to draw attention to is this is mainly attributed to health insurance cost. So the facility has a self-funded health insurance program, and we had a number of large claims that we had to pay as part of that health insurance program this year. Up until about April, our health insurance program was running right at budget where we were expecting it to. The last several months, we've seen that number creep up. So it is running a little higher than what we had expected, and that's something we'll be looking at when it comes time for open enrollment, whether continuing with a self-funded insurance plan is going to be the best choice for the facility going forward. Change in net position was negative $193,006, and census was behind budget for the month of June by 3.26 bed days. Overall, year to date, we've had revenue is $362,429 behind budget. Expenses are $114,408 over budget, with a change in net position from operations of negative $476,837. Census overall is only behind budget by 1.39, and so far this year we've had, as of June, had 317 admissions and 300 discharges. On the next page, it shows you a census graph of the year to date, so I'd like to show you that. What we are actually experiencing right now with census is something that we haven't experienced since 2020. We are seeing a huge census growth this last part of July into this first part of August. As of today, we have 2 empty beds in the facility, and we believe that they'll be filled before the end of the day today. So that is something that we haven't seen in quite some time. And I think that that's important to be able to share with you and note as we're kind of looking at some of those financial aspects of things. Moving into the additional financial narrative, once again, we did that budget amendment for April financials. We reduced the census and reallocated several lines of expenses to try and help bring those in line with what we were seeing with actuals. Cash on hand is estimated at 38 days. Now, we do have some changes with the payments that we've had earmarked to go to Medicaid. Now, if you recall, at the end of last year, we had the $3.6 million shortfall that we needed to pay back to Medicaid. We did receive an invoice for $243,515.52. Let me take that back. Not an invoice, a remittance advice. So they reduced our income by that amount to repay that back to the state. And in July, we also had that reduced out of our payment amount of, for $716,485.48. So that takes care of a good chunk of that amount that needs to be paid back, leaving us with $2.63 million that still needs to be paid back to the state. The good news with that is the facility has received a payment, or will be receiving a payment in August for certified public expenditures. So this is money that we spent above what was reimbursed to us by Medicaid. And the amount of that certified public expenditure payment back to the facility is $1.4 million. And the state is going to be reducing that by $1,316.85 to offset that overpayment. So the good thing with that is it's not going to reduce our days cash on hand that we already have sitting there. So that timing worked out quite nicely, actually. I also wanted to share we have a new Medicaid rate that's going to be starting October 1st, and the estimated change in that Medicaid rate is an increase of $42 or $43 per resident per day. So that equates to about $2 million of additional revenue over the course of the year. And because that starts in October, we're going to see some of that going into our fiscal year of 2025, which will help offset the budget deficit we currently have. So I thought that was important to share with you as well. We do have a projected usage of MOE of $168,000. That would be for our bond interest, and we'll be bringing that resolution forward next month to you for your approval. And then the final thing I just wanted to touch on is the MOE rate freeze legislation that is currently been introduced. It's House Bill 4726. This bill would help keep the county's MOE obligation frozen at $15 per Medicaid resident per day. This is an amount that you as the county pay to the state. It's not something that the facility pays. This rate freeze is something that sunsets every few years. And I just want to draw attention to how important this is going to be, especially with such a large Medicaid increase for the facility. The impact to the county's MOE obligation looks like it could jump from $15 a day per Medicaid resident per day to $55 per Medicaid resident per day. So I would really encourage you to advocate that that freeze stay in place, because that would be a huge impact for funding from the county that you'd have to pay for to the state. So I just wanted to draw that to everybody's attention. And then with that, does anybody have any questions?
Commissioner Williams, please.
Thank you, Mr. Chair. First off, I was glad to see the quality numbers, to see those rankings, to be in the position that they are. Good to see that admissions are up. I know that you mentioned that in, I think it was April, you guys did a budget amendment, but as we look at the numbers presented today, expenses continue to run high, and revenue continues to run low. I'm just curious if we were not progressive enough in the budget amendment.
So I can see where your concern is with that. I will say the expenses have fallen in line with the budget amendment with the exception of those higher than expected healthcare costs. So if you take that out of the mix, the expenses fall in line with what we had budgeted.
Okay.
As far as the census itself, for the months of April and May, we were aligning to that census. In June, we had some challenges in our admissions department, which I do believe had an impact on that census. And so before I was to pass judgment on whether that was an effective budget amendment, I really want to see where July sits, especially with the higher census. In June, we did have our admissions coordinator who had been with us for 35 years retire. And then we were training a new person to bring them on board. And I think during that training time, we've seen a slowdown in admissions because they were taking the time to do the training. And that's reflective in the number of admissions and discharges that you see in the month of June compared to the other 2 months ahead of time.
Okay, and then finally, with the number of beds that you're projecting to have, will that put us closer in line with our budget?
So our budget right now is set for 184 for the whole year, and with having the level of census that we're at now, that will move us progressively closer to meeting that for the whole year. Right now, we're sitting at about an average of 181. So I'd like to see a couple months of that. But again, if this current trend, and we did implement a new software in our admissions program as well that I think is helping us with maintaining this higher level census. If those things do add up to multiple months, I think we're going to be in a good shape as far as what we had budgeted for census.
Good, good. Thank you. Thank you. Nothing further, Mr. Chair.
The MOE freeze legislation, so you're looking for advocacy for House Bill 4736, right?
Yes, sir.
Or 4726, I'm sorry, 4726.
Yes, sir.
Okay, thank you. Any further questions for the medical care facility? Chair will entertain a motion to receive the report.
So moved. Support.
Thank you, Commissioner Bear and Commissioner Williams. All those in favor will please say aye. Aye. Any opposed? Thank you.
Thank you very
Thank you,
much.
Destiny. Now on to the medical examiner's office. I see the doctor here. Looking forward to hearing of your proposal, sir.
Hey, good afternoon, everyone. The medical examiner's office, to start off, essentially is functioning as a regional office. A few years back, Henry Ford Allegiance closed its morgue, so Jackson County built its own morgue. Then in Lenawee County, Bixby and ProMedica closed their morgue. And at that point, I went to administration and said, why don't we rent or share our morgue so that would help also defray the costs for Jackson County. As a result of that, we have have formed a functional relationship of being a regional medical examiner area here. It hasn't been formalized yet, but we essentially function as that. As a result of that, we essentially have 2 full-time people in the office and 1 part-time that are doing essentially all the work for all 3 counties. That has created a lot of work for them. So as a result of that, and since we run the morgue itself, we have requested a full-time position to be a medical examiner, field investigator, lead investigator. And that lead investigator would relieve the current staff of some of the responsibilities that they do. They would be responsible for reviewing the case reviews and the reports written by our field investigators to maintain quality and to reduce the liability, with those reports. And since we are actively recruiting additional medical examiner field investigators, they would also be responsible for training them. And that lead position would also act as a backup. There are enough cases that that requires actually being a full-time position. As of today, Jackson, we have investigated or had reported to us 425 cases, Lenawee 178, and Hillsdale 81. To date, that's a total of 684. We're projecting that we're going to be over or at about 1,134 cases by the end of the year. And our busiest 3 months have not come up yet because that's usually October, November, and December. And of those cases, we do roughly 33% are autopsied for that. So that just shows you the amount of work that is primarily done. And then the second request that we have is that we have a part-time position, which is a lead pathology assistant who will be working primarily with the pathologist, would maintain the morgue, identify problems in the morgue, order all the necessary supplies, and would fill in also as a morgue or as needed for particular cases when we have difficulty in getting someone who to come in and assist on the schedule of the pathologists.
Commissioner Williams, please.
Thank you, Mr. Chair. So just a couple questions, just for clarity for me. So this is, what you've presented on today are two separate items, is that correct?
Correct.
Okay. So for the first item, I noted that the cost of this was split between Lenawee, Hillsdale, and Jackson. Is that correct?
Yes, both of the positions would be shared
split,
between
okay.
all three because we're functioning as a regional. So, and we've already presented it to Lenawee, and they understand. And I'm not sure, Tim, have we presented it to Hillsdale? They're aware of it, I know, after talking with Lenawee administrator.
Okay. Just based off of, and maybe I'm speaking to Ford on this, but based off the conversations that you've had thus far, is it likely that those motions would pass there?
I know Lenawee is for sure on board. Hillsdale has had some questions, and, essentially, they do not like to be told what to do by another entity.
I see.
Okay? And I know that Lenawee has talked to them and told them that someone is going to tell them what to do unless they build their own morgue and are independent. And they technically will not be able to afford that. So they will be informed. One of the things that I think may be a little bit touchy is I know that at times calculations have been based on the number of autopsies that are performed by each county, but that is really inaccurate and variable. I have proposed and have suggested that the percentage of the cost of the medical examiner's office when we regionalize is based on the population of the county. So we total up the total county population for all three counties, and that percentage is what they pay of our expenses. That's what I have been telling each of the counties.
Okay. And then finally, the Jackson share, if you will, would this be coming from general treasury or general fund, excuse me? Okay. And this has been accounted for already in the 26 budget? Perfect. Okay. Thank you, Mr. Chair. Nothing further.
Chair Shotwell had a question.
You answered a lot of my questions, Dr. Mano, there when you started with it, but my one question to you, when Lenawee had its own operation going before, how many employees did it have? And also, when Jackson was doing it here, I realized you were there, but how many other employees were at the facility here at Foot Hospital?
No one at Foot Hospital. The county has functioned independent. So before all of this happened, it was just Jill Glare and myself. And I've always been available 24/7 by the phone and using the electronic world. So in Hillsdale, it was Dr. Casson was the pathologist there, and then Sarah Palmani was their administrative assistant, so just one person there, okay? I'm not sure if Patty McKenzie, who now is working half-time for Lenawee, when Sarah is here, and that's being paid separately by Lenawee. But those are all, but the numbers have significantly, increased. The other issue and problems that we're having, and I've mentioned it before in other reports, are unclaimed bodies, and which we have to go through a complete due diligence to find next of kin, report it to the various agencies to try and get payment and take care of the decedent. The next issue that is becoming a real big issue is that many of the primary care physicians, most of our statistics are 70, I can tell you exactly, 63% of the deaths that we investigate are natural. Okay, that means the majority of them can be filled out by their primary care physician. They really fall outside of the medical examiner's jurisdiction. However, the death certificate has to be by law technically completed within 48 hours of the death, and many of the primary care physicians are refusing to fill out the death certificates. They have all the medical records of the patients, we don't. By default, the medical examiner's office has to complete those death certificates. So our office has to go and obtain all the medical records from the hospitals, clinics, and the doctor's office. I have to review them and then determine what the cause of death is, and then complete the death certificate. So the work is increasing. The other thing is that the state is requiring multiple committees that we are involved in. One is the Child Death Review Committee. Number two is the Opiate Fatality Review Committee, and we do it for all 3 counties. And then the one that is proposed in the future to come is going to be an Elderly Death Review Committee. Our statistics show that 84% of the deaths that we have investigated are over the age of 50.
Thank you, Doctor.
Commissioner Bear has a question.
Thank you. This position isn't funded in the current budget. So where for 2025 are you going to get the monies for this position?
This position is proposed to start in January 26.
Start January 2026? Have you had input into the budget? And is this money included in the 2026 budget, which we have not seen yet?
We have discussed it with administration and with finance.
So you're,
Yes.
thank you.
Commissioner Kennedy, please.
Hi, Dr. Mano. How you doing today?
Fine. Yourself?
Pretty good. My one question is, and it might be for administration, it might be for you. You had mentioned Hillsdale, and I've watched things that go on with that commission. If they opted out and decided, voted no, they didn't want to do this, it's not something we could force them to do. And if they opted to go on their own and find their own way, what would be our path then? Would we still take on the positions, or?
What would end up happening, and administration can, I know Lenawee is on board from my talks with them, so it would only become a 2-county at that point. And at one time, Livingston looked at joining us in the past, but decided not to. I can tell you that right now, Sarah and Tim attend what is called the Medical Administrators Meeting, which meets every 2 months. These are administrators from a number of medical examiner systems. Oakland and Macomb County is one entity. Western Med is the other. They have 13 counties that they cover. Mid-Michigan has 14 counties. Kent County, Sparrow, 5 counties. Wayne, and then, our 3 counties. And, you know, they meet to discuss the issues that are common to all of the medical examiner's offices, discuss suggestions and how to solve some of the problems and issues. So if Hillsdale opts out, they're not going to find a better opportunity. They had issues when they were doing, I think it was Lucas County in Ohio or Indiana. They had issues there, and so that's when they went to Lenawee. And then when Lenawee decided to join us, they kind of piggybacked along. One of the things to allay their concerns is I have proposed that we have a advisory committee of at least one representative from each of the counties to meet, at least biannually with Sarah, Tim, and myself to discuss issues in the medical examiners, to address the issues that come up, and then they report, as necessary to their Board of Commissioners. And the reason why I had picked 3 is the ideal committee to get work done is less than 7 statistically, but it could be 1 to 2 per county.
So what you're basically saying is they're not going to find a more cost-effective place elsewhere.
No.
But if they did, out of stubbornness, decide to go somewhere else, and it's just our 2 counties and the caseload reduced, you would come back and restructure?
The caseload would only be reduced. I've made a projection. Just 1 minute.
You don't need to look for it, the chairman just clicked.
139 cases would only be
Okay.
out of the over 1,000.
Okay. All right, thank you, thank you, doctor, appreciate it.
Okay, so let's take each of the requests in turn. Chair will entertain a motion to adopt the staff recommendation as to the lead medical examiner investigator.
So move.
Thank you, Commissioner Williams and Commissioner Bear. All in favor of the motion will please say aye. Aye. Are there any opposed? Thank you. And now, Commissioners, we will take the proposed lead pathology assistant. The chair will entertain a motion to adopt the staff recommendation.
So moved.
Support.
Thank you, Commissioner Bear and Commissioner Williams. Any further questions? We have a 3-person quorum. I think we're good with voting the 3 of us, correct? Okay. All those in favor of the motion will please say aye. Aye. Are there any opposed? Thank you, Dr. Mano.
The one thing that I would say to you is our office is always open. I'm always available. And if any of the commissioners have any concerns or questions, feel free to call me because I'm more than willing to address your concerns and issues and look at solutions.
At some point, I'd like to go through there when it's not inconvenient. It's
That can
never
be
not
at any
inconvenient.
that can be at any time.
Thank you, Doctor. Appreciate your work very much. We will now move on to the Health Department. I see Kristen Pluta is here. The first topic being the August Schools Electronic Health Record System Contract.
Yes, good afternoon, Commissioners. I have before you a request for a 5-year contract for August Schools. August is the name, although I do bring it in August. August is the name of the software. And just to give a little bit of information to caveat kind of why the 5-year and why now, because the attachment that I have with you is for a contract, a 1-year contract that we just signed in April. As you know, we just started the school wellness program with Concord. Last year was its first year in entirety. And through that program, and as the state, through funding, has been getting programs and through the Children's Adolescent Healthcare Program up and going. They have distributed funding through that in a separate grant. So we have an operations grant, and then depending on the year, we've been given renovation funds. That renovation funds can also be used for things, basically anything that is required to get the program up and going. And so we have renovation funds this year that we will actually have to send back to the state if we don't expend them all, and that ends September 30th. And so we worked with the state to determine how we could use the rest of those funds, but use them up front. So we started a contract to try this software out, because we've been through a couple testing them over the last year and a half since we started the program, and we've done paper charting. And so although we've only been working with this program for about 4 months now, it is meeting our needs. And so in order to not have to dip into our operational funding, if we sign a 5-year contract with them, not only do they give us a 20% discount on our annual cost or our overall cost per year, but we can use that renovation in construction funds instead of having to spend nearly $14,000 out of our operational grant. So that was a lot. The total for 5 years is $55,200. We're actually not asking that contract to be signed until the end of next March.
Questions for the Health Department? Seeing no questions, the chair will entertain a motion to adopt the staff recommendation.
So moved.
Support.
Commissioner Bear and Commissioner Williams. Any further questions? All those in favor will please say aye. Aye. Any opposed? Thank you.
Thank you.
And then on to your monthly report.
Yes, I have a monthly report in standard form. I generally, just due to the order, I tend to kind of focus a little bit on some of the community health education and promotion. And it's, a little bit more, where we're at and where we're out in the community. So those first couple pages focus on that. I will jump over. We've added a couple different graphs this month in the personal and preventative health. And we'll additionally have some extra to point out in the next, in the September report as well. So our WIC report, we do have a graph there, not a graph, a chart there talking about the enrollment. We are seeing decreasing numbers in WIC. We have been for a little while. Numbers significantly increased back in 2020, 21, and 22. At that point, there was automatic enrollment in WIC if you qualified for Medicaid or were on Medicaid. That's all you had to do was show that you were on Medicaid, and you were automatically qualified for the WIC program. That automatic enrollment will be ending, I believe, at this upcoming fiscal year. So we may see, what that means is that individuals coming in to get on the WIC program, so moms and dads with kids with under the age of 5 will now have to provide financial documentation in order to qualify for the program again. So, we're hoping to get information out there, educate parents on, what might be needed for that, so we can keep our enrollment up. What I will say, even though those numbers, continue to have kind of a slow decline, our funding has remained the same for this next fiscal year. So we are just continually trying to, be out there, outreach. You'll also see some information on, some of our goals for the past year, to focusing on nutrition education. When we actually get into the annual report, which is my next one, looking at some of those things and how we've increased our activity on some of those goals going forward. So one thing to note on the immunizations, something that came from a staff meeting and staff thought on how we could promote immunizations while people are already in our building. So as I mentioned, all of these people come into our building for their WIC appointments. and they may or may not already be in need of some sort of immunization. We now have our clinic, our immunization clinic, working with our WIC department to look at the upcoming appointments for the following day and week and see where we might, what that individual child might be eligible for. If they're, eligible for something, we have that information right there at hand in the appointment while the person is there, and can potentially walk them over to the immunization and get them in over there, get that done. One thing we do know is that once someone leaves, the chances of getting them back in for something like that can be challenging. So the more, services we can meet and provide for individuals while they're in our building, we want to do those referrals right then and there. Last page of the personal and preventative health service is just some information on communicable disease. Also, interestingly, across the state and here in Jackson, the cases of Lyme disease has substantially increased over time. It's something from the health department perspective, what we're currently doing at the time. We don't do a whole lot with Lyme cases, but track that, and then we can work on advocacy, education, outreach. Also important is to notify the healthcare providers in the community that these are the trends that we're seeing, so they can be looking for signs and symptoms of that and checking for that disease. Environmental health and community health education and promotion, both of those, all of that information is there for you. If you have any questions, I'll take those.
Questions for the Health Department? Commissioner Bear, please.
Thank you. How much are you involved in the supplemental food programs?
The only thing to caveat that, WIC, the whole WIC program is part of the USDA's SNAP funding. So that is in of itself part of the SNAP program. The only other thing we have that has actually ended, and you will not see it in the fiscal year 2026 budget, is a program called LANA. I've talked about it in here. You would have seen information about it in the community health education and promotion section, where we had a health educator going into preschools, Head Start programs, and teaching kids about, we take like a sample or help them learn how to cook something, or have them try some new kind of fruit or vegetable, and teach them about education with tools and tips and things to take home to maybe share with their parents. And then addition to that, over the last couple years, we've had a food navigator program where again a health educator would be at the farmers market, the Grand Rivers Farmers Market, every Friday afternoon with samples of whatever is in season and a recipe for individuals that are there to try. But those two programs are ending for us. We will not receive funding from that.
So those are the two programs where persons are issued
We do not do any of the issue that our funding comes from that same pot of funding, but we do not do any issuance of the actual SNAP or EBT cards.
Okay, thank you.
I had a question. What is anaplasmosis?
Well, I certainly wish Matthew Budd was here to tell you more about
'Cause he
that
could tell
today.
you. Okay, I got to Google it, I guess. I don't know what anaplasmosis is.
It's not a common one that we see, and that's, really the best that I can tell you. He told me about it, but, the number of those kind of things that I see, I can't retain in my brain.
Sorry
So
to-
I
sorry to
will
ask-
literally
sorry to
just
ask the
say,
question, sorry.
I don't know enough to give you a great
Okay.
great description of that.
I'd like to
so.
visit with you. I got a brief thing afterwards,
Sure.
if we can do that. Chair will entertain a motion to receive the Health Department's report.
So moved.
Thank you, Commissioner Bear and Commissioner Williams. All in favor will please say aye. Aye. Any opposed? Thank you. We've got Health Department Annual Report 2024, is that right?
Yes.
Okay. Go ahead.
So I'm not going to go through this. You have this. Generally, I just bring it to you each year just for your review. It's been a couple years since we've kind of done it in the, I've basically just been giving you the statistical reports, so kind of all of the statistics that go behind creating this year. We thought it was important to kind of bring that out in a more friendly, user-friendly, easier to read document instead of just multiple pages of statistics. So just note that that's there, and I am happy to answer any questions about anything in there.
Okay. Chair will entertain a motion to receive the report. Thank you, Commissioner Williams and Commissioner Bear. All those in favor will please say aye. Aye. Any opposed? Thank you. Thank you, Kristen. Appreciate you being here today.
Thank you.
We'll move on to the next item, which is claims. Chair will entertain a motion to pay the claims. Thank you, Commissioner Williams and Commissioner Bear. All those in favor will please say aye. Aye. Any opposed? Thank you. Please take note of other minutes. The DHHS Board meeting minutes is in your packet. Please take note of the reporting schedule for next month, which is DHHS, MSU Extension, and the medical examiner. You're here again next month, Dr. Mano?
Yes.
Okay, very good. We look forward to it. We are now back up to public comment. Is there public comment? Please, Dr. Mano.
To answer your question, anaplasmosis is a bacterial infection transmitted by a tick, most commonly by after the tick has bitten an infected animal. And the real issue is a majority of people, a big portion of them aren't aware that they have an infection, and so it becomes an issue when they donate blood and transmit, and the blood is donated to someone else, they can transmit the infection that way.
Okay. Thank you, sir. Any other public comment? Seeing none, public comment is now closed. Move to committee member comments. Any committee member comments? Seeing none, we stand adjourned at the call of the chair.